Hey everybody, Dr. Holly Tucker here. So we are back again this week, and the topic that we're discussing is how are acupuncture and nutrition related. So likely you've heard of both of these concepts and how they can be applied to certain health conditions, but maybe you haven't seen how they exactly fit together. So I'm going to explain a little bit more about that, my approach, what I do with my patients. And so what I have seen over the years and with my own health story, my own health journey, is that there's very specific things that these therapies can do for you for different reasons. So just the same as you would see someone in our chiropractic office on one side for one condition, you may see me for another condition for acupuncture, or I may take a different approach and try nutrition as well. So a little graphic here. So you've probably seen this before when you've seen something related to ancient Chinese medicine, like a yin-yang or a yin and yang. And so what this symbol represents is the balance between light and dark. And so in Chinese medicine, you have a lot of these opposing forces. You have an excess of something or a deficiency of something, where you have too much heat or too much cold or too much dampness or too much wind in the body. So they describe things very literally, and they almost describe things internally like we do externally, like with weather and season change and that sort of thing. So just a completely different approach and almost a different language to how things are evaluated. But what we can see with nutrition is that it's very much, what we put in our body has an impact on how our body expresses itself, right? So if we are not feeding ourselves well, or we're feeding ourselves things that we're actually sensitive to, or we're just eating too much of things that our body just can't digest well, that those can start to have some health implications. So my own story with nutrition is that I grew up having a whole host of digestive issues, and I guess I thought it was just normal to have all those issues. But I decided to go gluten-free when I was in chiropractic school because all the cool kids were doing it, right? And I was trying to learn a little bit more about nutrition. And as I started to peel it back, I realized, wow, like every meal of every day for my entire life has included this base, this staple food of wheat or pasta or grains and breads and that sort of thing. So started to peel it back, and honestly, I tell you, it's hard. I've gone through it, and it takes a long time. It can take up to 6 months to really realize everything that you're eating that may have gluten in it, and for your body to completely clear it. Now, that doesn't mean that I want to turn every single one of my patients into being gluten-free, but we do have to sort of evaluate, are there certain things within your diet that could be playing a bigger role to your overall health, and is it really worth it to hang on to those things, right? So I went gluten-free. I did that for about nine months, and then I thought, I'm just going to start reintroducing it. Maybe this wasn't really for me. Now, I did experience a very quick weight loss that I wasn't even trying to lose within that first few weeks of going gluten-free. So I thought, well, okay, that was weird. But then when I reintroduced it, 9 months to a year later, all those digestive symptoms came back, and I thought, wow, I hadn't had any of that this whole time, and I just didn't even realize that I wasn't experiencing it. So I think that rapid weight loss in the very beginning was essentially deflaming my body, or getting rid of all that chronic inflammation. And so inflammation is what underlies pretty much every chemical process within our bodies. It's required for healing, but it's also could be to a detriment and start to cause disease that happens. So what I like to teach my patients is something that I call intentional daily nutrition. And so we are looking at things that you're eating every single day, at every single meal, to say, is this something that I'm investing in my health, or is this something that may lead to more of an illness or sickness or a disease process? And so that's how I want to teach my children about health too. We want to intentionally eat foods that are going to be well-rounded and healthy for us, and that we can have treats when we want treats. It's Halloween today if you're watching this in live time. We do let our kids have some candy, but they're not going to overindulge, and we definitely limit how that happens week by week and day by day. It's not going to be something that we're going to continue eating every single day until it's gone. We're going to enjoy the treat, and it's going to be gone after that. But when we think about, just sort of like common sense, when we're thinking about the lightness and the dark and the yin and the yang, if you have cravings for something, we need to look at why do you have cravings for certain things. I know cravings is usually something you associate with pregnant women, but women, men, anybody can have cravings at any time, and it's usually just a message that your body's trying to send you that you need a specific micronutrient or even a macronutrient in your body that you're not getting. And so I teach my patients about eating abundantly, so eating a lot of really great foods and not necessarily having a limit to them. I never approach it as a diet or that it's scarcity or that you have to cut back on, not eat as much. If you're hungry, your body needs energy and it needs nutrition. So we just need to find the right things to feed it. So pretty much every patient in my office, no matter what they're coming in for, is going to be asked what a typical day, breakfast, lunch, and dinner looks like. And then for my female patients, we're also going to be asked about their cycles because we want to match those two things up and see if there's any irregularities that are happening within the major hormonal systems of the body. So I hope this information kind of gives you a little bit more background. Next week and a couple weeks following, we're going to dive into a couple of stress-related conditions and how you can manage those yourselves and other resources that you can have to manage certain things that stress causes within the body. So I hope everybody has a wonderful day. I'm going to be developing some guidelines that can be downloaded that you can use at home when we're thinking about daily nutrition and what are those big things that you want to get out of your day and out of your lifestyle. So if you are interested in that, shoot us a message here on the Facebook page and I will be sure to see it. Thanks.